Hey everyone, welcome back to our channel. Today, we're diving into the world of boxing, a sport demanding grit, determination, and an unwavering will to conquer. We're talking about two warriors stepping into a squared circle, throwing hands like their lives depend on it. We're gonna break down the 10 most common injuries these warriors face every time they lace up their gloves. From concussions to fractures, every punch carries the risk of serious damage. Let's get started. First up, we're talking about the money makers, the tools of the trade, the hands. Fractures, sprains, you name it, these guys put their hands through the ringer. The force of those punches, especially when you're landing on bone, can be brutal. It's a recipe for disaster if you don't take care of your hands. Common fractures include the boxer's fracture, which affects the metacarpal bones, and Bennett's fracture, impacting the base of the thumb. Sprains often involve the ligaments, with the thumb's ulnar collateral ligament being particularly vulnerable. Proper wrapping, strengthening exercises, and immediate care are crucial to prevent long-term damage. Next up, we got the wrists, the unsung heroes of boxing. They might not get the glory, but trust me, they're crucial for delivering those knockout blows. We're talking sprains, fractures, and tendinitis, often caused by improper technique or lack of support. Common causes include overextension, repetitive strain, and inadequate wrist wraps. Treatments range from rest and ice to physical therapy, and in severe cases, surgery. Strengthening exercises and proper technique are key to prevention. So next time you see a fighter throwing a haymaker, remember, a strong wrist can make all the difference. Let's move on to the shoulders, the engine room of a boxer's arsenal. These muscles are working overtime, generating the power and rotation for every punch thrown. Rotator cuff tears are common, involving the muscles and tendons that stabilize the shoulder. These tears can cause significant pain and limit your range of motion. Shoulder dislocations occur when the upper arm bone pops out of the shoulder socket, leading to instability and chronic pain if not properly treated. Chapter 4, Elbow Inferno, when the fire within burns you out. Now let's talk about the elbows, those bony hinges that take a beating in the ring. Every jab, every cross, every hook puts stress on those elbows. Hyperextension occurs when the elbow is forced to bend the wrong way, stretching or tearing ligaments. Tendinitis, on the other hand, is the inflammation of the tendons due to repetitive strain. These conditions can cause pain, swelling, and reduced mobility, making it crucial for fighters to seek proper treatment and rest. Chapter 6, the face, a canvas of courage marked by battle. Let's be real, folks. In boxing, your face is gonna take some punishment. Cuts, bruises, black eyes, those are badges of honor in this sport. We're talking broken noses, which can obstruct breathing and require realignment, and fractured cheekbones that may need surgical plates. Jaw injuries can be severe, sometimes necessitating wiring shut for weeks, impacting speech and diet. Chapter 7, protecting the windows to the soul eye injuries. Now let's talk about the eyes, the windows to the soul, and in boxing, incredibly vulnerable targets. We're talking about serious conditions like detached retinas, which occur when the retina peels away from its underlying layer of support tissue. This can lead to permanent vision loss if not treated promptly. Corneal abrasions are another common injury, involving scratches on the cornea that can cause significant pain, redness, and sensitivity to light. Orbital fractures or broken bones around the eye socket can also occur, leading to double vision and other complications. These injuries can permanently affect a fighter's vision. Now let's address the elephant in the room, the issue that's plagued boxing for far too long. Concussions. Concussions are serious brain traumas that can have long-term consequences. Symptoms can include headaches, dizziness, confusion, and memory loss. Repeated blows to the head can lead to chronic traumatic encephalopathy, or CTE, a degenerative brain condition. It's a sobering reality, and it's why we need to take concussions seriously. Early detection and proper management are crucial to protect a fighter's future. Chapter 8. Moving down the body, let's talk about the ribs, those protective bones that shield our vital organs. In boxing, they're prime targets for body shots, and let me tell you, those hurt. Cracked ribs can cause sharp pain, difficulty breathing, and even damage to internal organs. Bruised cartilage, on the other hand, leads to persistent pain and inflammation, often requiring weeks of recovery. Chapter 10. Now, let's talk about the knees, those crucial joints responsible for a fighter's agility and movement. In boxing, you need to be light on your feet, constantly pivoting, changing direction. This puts immense stress on the knees, leading to injuries like ACL tears and meniscus injuries. An ACL tear, for instance, involves the anterior cruciate ligament, a key stabilizer in the knee. Meniscus injuries affect the cartilage that cushions the knee joint. Both can sideline a fighter for months, even years, requiring extensive rehabilitation and sometimes surgery. Chapter 10. Finally, let's talk about the ankles, the foundation of a boxer's stance and movement. These joints endure tremendous stress, absorbing impact with every step, every pivot, every sudden change in direction. We're talking about sprains, which involve overstretching or tearing of the ligaments, and fractures where the bone itself is broken. Sprains can range from mild with slight stretching and microscopic tears to severe, with complete tears of the ligament. Fractures can vary from simple cracks to complex breaks requiring surgical intervention. Proper diagnosis and treatment are crucial for recovery, including rest, ice, compression, elevation, and in some cases, physical therapy or surgery. So, there you have it, folks, the 10 most common injuries these warriors face every time they step into the ring. Boxing is a high-impact sport that can lead to serious injuries, including concussions, fractures, and long-term brain damage. Chronic traumatic encephalopathy, CTE, is a significant risk for fighters, often resulting from repeated head trauma. It's crucial to understand these risks and take preventive measures, such as proper training, protective gear, and regular medical checkups. Appreciate the grit, the determination, the heart it takes to step into that squared circle. Thanks for watching. If you found this video helpful, make sure to like, comment, and subscribe for more content. Stay safe and keep fighting strong.